Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University and the Alan B. Levan Innovation Center, which is a combined effort between Broward County and Nova Southeastern University. Today we have a very interesting subject. We have a lot of calls from people, or notes from people, relative to what's going on with electronic health records. What are these things? I mean, can I talk to the doctor? How do we get to the information? I try to get a referral, and I got to go to the office and sit for 4 or 5 hours or whatever. Not quite 4 or 5 hours, but maybe an hour and a half. So I said, let's get somebody in here who has some insight into electronic health records. And who do I believe is the expert? She's before you right now. I'm introducing you to Cathy Bowers. And Cathy, you got a lot of acronyms after your name. So you give me the acronym and what you're certified in, and we'll tell everybody why you're the president of the National Patient Advocate.
Okay, thank you, and good morning. Welcome, everyone. I'm Cathy F. Bowers. I'm the founder and president of National Patient Advocate. I founded my company back about 15 years ago as a social worker background, not clinical. I saw the need and was experienced as a guardian to help people navigate and go through healthcare system. So I get calls from helping with billing and appeals to helping somebody go through a great divorce and didn't know how to cope with some of the challenges of getting on some of the programs that might help the person. So my first initial, I'm a board certified patient advocate. I'm also a certified paralegal. I'm a certified senior advisor. And additionally, I'm a nationally certified guardian. Well, with that being said, it just means that I have a lot of certifications. I also have a nonprofit background. So I really branded in the community as a resource and referral consultant. So I prepare a 7-page, I have professional support, which I gladly give out to anybody, the public, professionals, my colleagues, that help them, give them an idea of where to go for services. How do I apply for Medicaid? How do I tap into VA benefits? How do I get my older father, who's very stubborn and doesn't want to give up his license to drive? So it actually covers soup to nuts, as they say.
Let me just say to you that really what you do is so important because it involves so many different levels of what I would call judicial confidence in your work, and more importantly, in the behalf of the elements of the people who you deal with. Do you feel that way when you work?
Absolutely. Because of my broad-based knowledge in dealing in human services, it gives me a feeling for empathy to help and know where I can stay in my lane. So the beauty of our emerging wonderful field of patient advocacy navigation is where I can draw on experts that might have more, expertise in certain areas. So yes, it's just a wonderful emerging field, and I'm so glad to be a part of it.
First, I want to thank you right off the beginning of the show to thank you for what you do. But let's get into what can a patient see and do to their electronic medical record.
Okay, well, that's a interesting topic to delve into. Let me just clarify by pointing out 2 definitions. We have an electronic medical record. An electronic medical record is a digitized version of your health information, and it's usually just kept in one practice. So when you go to your physician, he'll make notes and he'll put you into the computer there. However, the big overall umbrella is called electronic health records. And this is the same thing. It's a digital version, but now you're able to communicate with other physicians. So if you ever go to a doctor, let's say you're internist and something comes up, he says, Cathy, gee, have you checked out? Maybe there's a little cardio issue going on, and I'd say, I would respond, and then he'd say, well, maybe we can get the records. He might have the ability right in real time to go into this format and be able to pull up some documents, which I obviously, it's not my skill set, haven't memorized. So the challenge is, how does the consumer meander through getting their records? And let me just back up a second. As about 22 years ago, when I was retraining myself to come into the field of care management and guardianship, I worked in a doctor's office, $10 an hour, 20 hours a week, but that was the best education I had. I was the one who picked up the phone and did scheduling and had to find clients' charts. So when a patient was coming in, we had to go look for the charts. Well, guess what? Sometimes we couldn't find the charts. So that was an issue with paper. And so sometimes the doctors, we couldn't, the handwriting in general wasn't maybe be that legible. But I will say this, consider you going to the doctor and getting a prescription for medicine, and he writes down 25 milligrams, but somehow it gets interpreted as 250 milligrams. So that is something that you may not even be aware of that could happen. Maybe the pharmacist didn't read it correctly in the old days. Now, with the advent of electronic transmission, the doctor can just go ahead and send the prescription right to your pharmacy, and then hopefully you'll be able to check it for accuracy.
Do you have the opportunity to gain access to hospital records?
Yes. So I'll give you a case in point. Recently, a client of mine was in a major medical center here in Broward County, and she had been in there like about 6 months before. So when she was in the hospital and getting treatment, her sister and I walked down to what's called the medical record department, AKA Health Information Management. So I'd like everyone to realize you may come across HIM, that's the acronym, but at the end of the day, it's medical records. We were able to, right on the spot, get an authorization, carry it back up to the hospital room, have her sign it, bring it back down to the office, and within an hour or so, we had this much of files printed out for us so that the family could help understand and guide what was going on, and now she was back in the hospital. I think that was absolutely tremendous opportunity to have that right there, Johnny, on the spot. So I often challenge my clients, please do a site visit to your local hospital. Make sure, or call on the phone to a new doctor. Just make sure you understand what their procedures are. I think some of the frustration and challenges, both on the provider and the patient side, is just the communication may not be very clear. So in essence, having the opportunity to go into like a My Chart, you'll hear terms like maybe Epic is a software, where a depository of records. There are several of them, around, Athena Health and Serene, just to name a few.
Well, the reason I say that is because I really think that that's a tremendous additional safety service that is, if there's any place where you need electronic medical records that should be available, it's when, fortunately or unfortunately, it could be a happiness, it could be the birth of a child or whatever, but there could be complications. But then there's some very serious things that are occurring, and it's an imperative to have the access to that information. I mean, not to personalize it, but I've had surgical events in hospitals, and when you know that the pre-op, the workup to that hospital visit is already in their hands without them having to ask, it's right there. It's very, very helpful. I believe it gets to the point of preventing errors which occur, not purposely, but occur. and it also makes for a better opportunity for the physician to have all of the knowledge relative to the individual that they're working on.
100%. And just to take it a step further, I'm understanding that Apple and Samsung, you now can get an app on your phone to deposit your health information. Now, I may be a little old school, but I don't do a lot on my phone in terms of that. I like to sit in front of my computer. But if you're traveling, let's say you're in California visiting your grandkids and a medical mishap happens, again, in real time now, you're possibly being able to get into either your app on the phone or get back to your My Chart and be able to get everything you need. But at the end of the day, I'm still a firm believer in keeping a paper copy. Let me give you a case in point. Roughly about a year ago, I believe, there was a major radiation and oncology practice here in Florida, but it's also national, and they got hacked and they were ransomed, and like people couldn't get access to their CD discs or their paper charts. What happens if someone was having a life-threatening emergency as a second consult and they couldn't have access to that? So that's why it's very important. I know people don't like clutter around the house, but if there's one thing you really want to maintain, it's your own personal health records.
It's really challenging to me as someone who has been involved here at Nova Southeastern University for 37 years to see how healthcare has moved to the levels of trying to protect the patient at the highest form of opportunity. And you're talking about what I believe to be probably the highest form of protection of that information as possible. Do you agree?
100%. Just again to kind of sum it up in my world, there's now encryption. There are certain covered entities that a physician, let's say a dentist, a pharmacist, a nursing home, must have encryption like software so that people, just like with the bank, they have levels of, third-party verification. So I think that's a very good move. But I always am concerned, what if I have a disabled client? What if they speak a foreign language? What if they don't know how to use, as you said, a computer, a tablet, a phone? Um, you can actually pick up a regular phone, and I've had help. I call when I had to go in, be preparing for this interview. I went into my chart to see if I could locate some records from 2007. And thank goodness there was a technical support that could walk me through the myriad of steps to go through. Unfortunately, I did it like 10 o'clock at night, and the phone wasn't being manned, particularly at that time. But there is help out there, and I do see a lot more in hospitals, in physicians' offices, taking an extra time and actually giving me an 8.5 by 11 piece of paper, one doctor, when I walked out. Here's the code. Here's how you got to get in if you can, avail yourself of that. So I think safety and protection of our data, yes, is important. So HIPAA form, which I use, it came out of the HIPAA Act, that allowed us now, I don't make any medical decisions for my clients, but if I need to speak to a doctor or the unit nurse at a hospital, I'm able, with their permission, and have them sign it, fax it in, or bring it in person and get the information I need.
Let me turn it to the other side. What are the benefits to the healthcare providers?
Well, I would say to the healthcare providers, they are now able to communicate with each other. They're able maybe to give you a printout and possibly go over it with you. So I think it increases their ability to maybe help even diagnose or give, overall in your treatment plan. I see a lot of positives in that realm. It used to be if you're at a doctor's office and there's something they need to know, they'll pick up the phone and maybe call the other doctor. And, people have not always available in that scene. So I guess what I'm saying is there looks to be a few different areas and ways that one can manage their own medical records from A to Z, meaning A, paper, that's all I want, and then Z, going strictly electronic and having all that information at your fingertips. But one of the things I did want to mention was that there was now even more transparency with some of the laws that have come about, where you can get a copy of not just a summary, but you can receive billing, you can receive clinical notes, radiology. So you're given an opportunity, once you're comfortable or need to be assisted in that, to get a good picture of your medical issues.
Yeah, I don't know why I got the call, but I guess it's because people of my previous responsibilities thought that I could answer every question that they have, and I really can't. But someone really, they got a notice, I won't say who the carrier is, but a very, very formative healthcare insuring provider. And down at the bottom it says that there was a notice that and this person was, I think, 78 years old, that your coverage may not, it's being reviewed. It's being reviewed. Well, the person got very upset because if they had to pay something other than through Medicare, and I guess they got another, I don't want to mention names, but they had another coverage, support coverage, that all of a sudden they were going to be charged $30,855. Well, I really couldn't give them an answer. In fact, I wouldn't even attempt to give them an answer because I don't want to get involved in any legal situations to wonderful people like yourself. But although I could probably turn to you for help, but I'm not the one to do it. I can recommend that they communicate with someone like yourself to get that help. Is that correct?
100%. And that again, let me go back to the accuracy. So when and if you get, even if it's this many pages or a few pages, please take the time to review it. If you need some help, hopefully a family member, a friend, maybe even a staff member in the hospital or a social worker can go over that information with you. Please check for any, as we mentioned earlier, any errors. And there are now some safeguards where you could ask the provider. Let's say the provider put down that I had brown eyes and I had blue eyes. And so it might not seem important, but if someone looked at me and I was in an emergent situation, they may not think it was the same person. I'm making light of that, but the importance that I want to stress is that by checking it and asking them, what is your procedure? When I mentioned earlier, pick up the phone every time you're making an appointment with the doctor. Very politely ask, may I please speak to the office manager or the practice manager? Find out what their policies are. What if there's an error? How do you correct it? And there are safeguards for that. But one other important thing that I might want to share is patient empowerment. This term of the patient-centered approach, when I was cutting my teeth back in 15 years ago, taking some certification, we're involving the patient in much more in their decision making, in being a team member. I consider myself a team member. So when I get hired, I'm a member of the team. I'm a facilitator or liaison, call it whatever you want. But we try to all work together to get very good outcomes that people, can benefit from.
Talking about people who are partners, I always like to throw this in because it's so important. When people call for an emergency and they call 911 and all of a sudden the firehouse, or usually the firehouse ambulance comes up and the EMT takes over. Well, the EMT now has immediate information because they're not going to be quandering about, although they're in communication with the hospital that they're going to deliver the person to. But it's such a masterful increase in opportunity to save people's lives. To me, it's unbelievable.
I agree 100%.
You know, we're down to just about the last 3 minutes of the show. It's 602nd show, and these shows wouldn't come to you without really the insistence of previous president of Nova Southeastern University, Raymond Ferrero, who's an unbelievable attorney, and he asked me to do a show called that, he didn't tell me the name. He said, do something on healthcare, because we had merged with Southeastern University to become Nova Southeastern University, and we have a plethora of programs. I mean, we are, particularly now that we have Dr. Harry Moon, who's now the president-elect, is going to be taking over in about a couple of weeks. And what happens is his foci is going to be dominantly, not overwhelmingly, to harm any of the programs, but he wants to make NSU Health a national, shall we say, recognized entity. But before we go anywhere, this is the last show which is being directed by a person that I could never have done these shows without my friend. I call her Rita Benita. Rita, how am I going to do this show without you? But I want to thank you for these multiple number of years. I don't want to tell everybody how old you are, but the reality is that the excellence of your editing, the control of the show, the providing us with the guests that come on the show is in your hands. I want to thank you on behalf of myself, the staff, and Nova Southeastern University. We wish you nothing but the very best in the future.
Well, it's been my pleasure to serve as the executive producer for Dateline Health since February 2005. So bringing the latest information in healthcare to the community, and it's been my pleasure on behalf of Nova Southeastern University. Thank you.
Thank you. I want to thank you one more time. Thank you very much, not only for the services that you provide to protect the people of the community, and but I want to thank you because you're a very kind and knowledgeable individual, and it's been a pleasure having you here today, and we're going to bring you back again. People are wondering how Rita is going to be replaced. She can't be replaced. But I've had communications with the people involved here at the Innovation Center and with Dr. Moon, and we intend to continue these broadcasts as long as the good Lord allows me to walk in through the doors. How about that? So you guys behind the cameras, stay with it, guys. Ladies and gentlemen, this program is called Dateline Health. We come to you from Nova Southeastern University. And remember, take good care of yourself. Until next time, see ya.